All right. Well, good afternoon. I have some topics I'd like to touch on a little bit, but I think there's some preoccupying topics, so we'll touch on that really quickly. So we did have a COVID-positive patient in our hospital pass away today. The patient had been in the hospital for several days, had a viral pneumonia, COVID-related pneumonia, and unfortunately was not able to recover from it. Had some ups and downs along the way. We wish he would have done well, but it's the way this course works in a small percentage of people. You know, if you look across the United States, you look at the data today, there's about 50,000 patients have been infected with this virus, and we have in the vicinity of 500 and change deaths, which is in the vicinity of about a 1% mortality rate, which is better than the stats that you hear from around the country. Italy, I think, is close to 9% currently. So there's success in what we're doing and how we're doing it. We're learning a lot every day about what we need to do. But at the end of the day, this virus can kill people. And it's something that we've been saying every day for many days, and trying to increase the understanding that the young and the healthy that carry the virus can spread it to others. To sort of focus on that note a little bit, we also had a confirmed case from a patient that was tested out of our emergency department. This was an adolescent that was tested several days ago, and they came back with a positive COVID. They've been home quarantining, we hope and believe, and should be recovering without any incident, not having any other complications or problems that we've heard of. So doing well from that. Health department is following up on that, and will give us further information going forward. And we're hoping that she does well and that things move forward from there. But we're anticipating further cases in the community, and we're anticipating that there'll be community spread of the disease. And until we start doing what we need to do about separating from one another and not breathing on one another and being far enough apart in shopping and everywhere that we go, this curve is going to continue an upward trend. So currently the cases that I'm familiar with, the adolescent that was tested and the COVID positive person that I just mentioned had passed away, both of those cases are travel-related infections. So we don't believe that they acquired it in our community. So that's what I have to say to that. We have a testing center I brought up before, a drive-through testing center. I would encourage everyone to utilize that center as a way of getting a test done. If you go into a brick and mortar building, you're exposing others and yourself to others, et cetera, and you're much better off if you go through the drive-through center to get tested if you really feel like you have this. We're still looking for patients to be tested only if they're symptomatic. There's very little information to suggest that an asymptomatic person, a person without a cough or fever, that has some inkling that they've been exposed to somebody, that they'll test positive. So you might get a false sense of security that you've got a negative test when in fact you've got the infection that's incubating, and later you'll be sick. So it's really important that we only test people that actually have fever, cough, or other symptoms suggesting of a viral respiratory tract illness, and then we can begin to capture the people that actually have this. Everybody stay quarantined, everybody stay home. But if you need to be tested, go through our testing center. You can do that through your provider. By calling your provider, they can screen and decide if you need to be tested, direct you to our testing center. We can get that done. You can also call 68-NURSE, and they'll do the screening there. And if they believe that you need to be tested, they'll direct you to our testing center as well. So we'd appreciate the help there in driving patients towards the testing center. We also have a upswelling of interest in our community and concern. More and more providers, I think more and more citizens are aware that this is real with the information that's coming out from us and from others about what's going on in the community. And with that, people are asking to help. We have a handful of doctors, more than that, a dozen or more doctors that have been reaching out looking to do something. They're putting together a group called Protect Our Front Line, with an organization that's looking to try to help educate grocers, retail outlets, et cetera, about what they can do. Obviously, shelter in place is the key to being successful in curving this and flattening the curve. But to shelter in place, we still need to get out every so often to get food and provisions to survive. And when we go out like that, there's risk associated with that. And if we're going into a grocery store and we're walking down an aisle and there's somebody walking in the opposite direction and they cough when we're going by them, there's risk. So we have everybody walking the same direction, staying at least 10 feet apart from one another. there's minimal risk. We can really flatten out this curve. We can stop this disease from spreading if we're thoughtful about these things. And you've heard me say it many times. You've heard the mayor say it. You've heard others say it. But it takes all of us working together to accomplish this. And so protect our front line group of physicians. Want to go out and help educate the retail outlets and others in the community and how to do this. You can also go onto the cdc.gov website, or you can go to dsh.texas.gov/coronavirus, and they've got information on there about what self-quarantine means, how to do the hygiene, how to clean surfaces, how to just be thoughtful about this. The more information you have, the more powerful you are in helping protect us all from this disease and keep our healthcare workers safe and keep each other safe and get us back to normal as soon as we can possibly get there. Thank you.
We'll just take questions.
Okay, and any questions right now?
Has there been an increase in those put into isolation in the COVID ward?
Okay, that's a good question. So we actually favorably, we had, I think I mentioned yesterday, 15 patients between the COVID ward and the critical care COVID unit. We've extubated a bunch of patients. We've got 2 patients now that are on ventilators only. We have 8 patients, well, we're going to have 9 patients in the COVID ward because one of the ones in the critical care unit are going to be moving to the COVID ward. So it's favorable movement and a decrease in patients coming into the hospital right now. That sounds really good, but I don't want anybody to let up their guard. This is still real. It's still out there. There's going to be more. But right now, things are looking pretty good. And one other point I wanted to make about that, because I think this is really important, it's pretty sobering to see a person die from a respiratory infection like this. It was an otherwise healthy human being that was doing well up until he got a cold, and then it just progressed like this till he died. But we've got several other patients that have been through this, and we believe the same infection. Unfortunately, the test results aren't back yet, but we believe so, that have recovered. And that is really expected. We're going to have about 15% of the patients that get this disease are going to be sick enough that they may require being in the hospital, and most of them are going to do fine. And we're going to get them through this. And with the critical care capabilities and the systems that we have in this country, it looks like we're doing a little bit better than many other countries have done. So our statistics may prove better, but there's still going to be deaths.
Can you tell us a little bit more about like the recent travel history of this the new patients, as well as, I'm not sure if you've got any more information about the one that passed away, where they've been within Midland before they entered the hospital?
Yeah, I don't, the family of the deceased has asked us to be as careful as we can with sharing information, so I'd prefer to stay off of that. I'm sure more information will be available going forward, but for right now I'd like to honor their request for privacy. The other case I'd rather leave to the health department to give the information about their travel experience in that, but I can say that they there's a family unit that had been traveling and had an exposure to, somebody in the family unit had an exposure to a known COVID positive person.
In addition to the adolescent and the one that passed away, is there a third confirmed case in Midland? And if so, is this person somehow related to either the states of Mississippi or Missouri?
There is another case I've been told by the health department. I don't know the details of that because it wasn't tested through our system. It was by a private physician in the community, and so that information went directly to the health department. I think they can give you more information about that, but that's not all I know about that particular case. Yeah.
Can you say what time of day did the patient pass away?
It was this morning.
At what point during the night did it get real critical where?
I can't, the exact time I couldn't really tell you. I can tell you that by the end of the business day yesterday, things were not looking very favorable. And it was during the night that it was determined that, and everybody got involved and recognized that inevitably he was going to pass. Yes, sir.
Has the use of hydrochloroquine been introduced in Midland yet?
There's a lot of information around that topic, and I think the simplest way to answer that question is yes. and we are using it in circumstances where we have a PUI or a person under investigation who is manifesting respiratory illness, and there's, with our infectious disease doctor and our critical care doctors, they come to the conclusion that they think the risk outweighs the benefit outweighs the risk. There's a lack of information about whether or not this really works. So we're using it in circumstances where we feel like it might, it's better to try than not to try, I guess would be the best way to say it. Yes, sir?
Was there anything like your doctors learned treating this patient that passed away that you would pass on to your current patient to help their care be better?
I'm sorry, repeat the question.
I was saying, is there anything you learned from like the previous patient that you treated? Anything like any insights on like how like the virus works and how it affects a person that can help you guys treat the new patients that are in?
Yeah, there's good information around that topic, and unfortunately, yesterday I was reading a piece by a physician out of Albert Einstein in New York City that's oversees 3 different hospitals and 7 critical care units and 80 critical care beds, over 50% of which are now occupied by COVID patients. So they've been dealing with this for a little while, and they're dealing with a lot of it. And unfortunately, this patient kind of followed the pathway that those patients can follow. And you do the best you can for the ones that you can save, and you try everything on every single patient, but there's going to be a small percentage that don't survive. And this fellow unfortunately fell in that category. That looking back on what the critical care guys did here, it was all the things that were described in this article. All the efforts were done exactly correctly, but you end up with multi-organ failure, and that's it.
And so the inevitability, was that tied more to his age or any other kind of condition that he might have been dealing with?
The only recognized factor that this individual had was age. So he's in his 60s, which puts him at a little higher risk than people that are younger than that. But no other significant underlying medical conditions that we were aware of.
Can you give us the exact age of the adolescent patient and the patient who passed?
No.
Yesterday you gave an age range of there were people who were adults but younger than 50. Can you give us a better picture of the age makeup of who is being sequestered in the hospital?
Currently we have, I think the youngest patient we have currently is 28. That patient is doing fine, and we anticipate we'll be getting well enough to be able to go home and recover. And the oldest are octogenarian.
Sorry. How many tests have you gotten back today?
Oh boy, we just walked through this. We have the 3 positives, and I believe we've had about 6 or 7 negatives so far.
So there's still 100.
100 plus.
Yeah.
Pending, yeah. Yes, sir.
And back to the testing, I had a few questions to piggyback off of that. Last time we spoke, you guys were talking about you guys are using now like a different local provider to get those tests through. How's that process been working so far?
So we switched over last week to one of the vendors, and that vendor has yet to get us a single result back. So yesterday we started sending to a other vendor that we've heard from local physicians that they were able to get tests back in about 24 hours. But the problem that arises is that when a vendor is recognized to be able to do it, and then we're not the only ones that heard that, so now they're going to get inundated as well. So I'm not really optimistic that they're going to do a whole lot better. I hope I'm wrong, and I hope they're going to do a lot better. We'll see in the next day or two if we get some more tests back from them more quickly. But it's been a struggle so far, and we're still looking at a week or so away from being able to do local tests. We're anticipating once we're able to do local tests, we'll only test people that are coming into the hospital, because there's still going to be a limited supply of testing availability and ability to do those tests. So we want to take care of the sickest, with getting information as quickly as we can to manage those patients. As that becomes more available, we'll test more widely, but for the time being, we're going to stick with that pathway. Yes, sir.
Now, aside from the situation with the vendor that you just mentioned, is there any other reason why the test results are taking so long to come back?
That's the only thing that we've been made aware of through our pathology department that they've told me, is that these sites are being overwhelmed with tests, and it's just a delay in being able to get them processed and through for us. The positive that we had this morning was, you may recall, I think the first time I spoke with you all, we were talking about a company called ARUP, and this is a test back from them, which is, we're looking at, 10 days post sampling, which is completely unacceptable, but it is what it is. It's what we're dealing with.
And
Yes,
so
sir.
at this point, do we have any kind of rough timeline of when you're kind of start to expect to get those tests back now? Or?
I think I said yesterday that I was expecting to get some back today. And we got back from the ARUP, but from the vendor that we had hoped to be getting them back within 24 to 48 hours. We're working on our 5th or 6th day now, and we still haven't had any test results back. So I'll say again, I hope tomorrow. Yes, sir.
You said yesterday up to 14 in the ward, possibly A third of those wouldn't be classified as persons under investigation, I believe. Today, how many persons under investigation?
I know that the 3 in the critical care unit are all considered valid PUIs per our critical care doctor. The 8 that were in the COVID ward, I can't tell you for sure. I haven't looked at their profile recently. You know, we had a bunch discharged today that are now home quarantined, which is a good thing. But so I don't know the mix right now exactly, but I'm sure there's a couple of others that we would consider at risk.
And not to just do math on the fly, but we're down to 11 being sequestered in the hospital with both critical and the COVID.
Yes, sir. Exactly.
And then I wanted to ask, what's the key criteria for people who need to be taken care of in the hospital and who need to be quarantined at home?
How sick they are. If the patient has an oxygen requirement, needs fluids, other management, then they would be hospitalized. If they're not needing any of those things, they can go home. Even people that might be considered otherwise at risk until, you know, I think for everybody's sake, they're better off at home than they are in the hospital. People do better at home than they do in the hospital.
And so what was the ratio of folks that are at home recovering and ones in the hospital?
I couldn't tell you that off the top of my head. I'm sorry. Yeah.
Did any hospital employees, or any hospital employees, persons under investigation?
We have hospital employees that we believe have been exposed. If you're working in a critical care unit in this kind of an environment with ventilated patients, et cetera, and you spend any time at all in the room, you are exposed by definition. So we have a number of providers and nurses that are working on the front lines that are at risk every day with what they're doing. We have no symptomatic exposed healthcare providers. So to my knowledge, we have nobody who's acquired the infection at this time.
At what point would you quarantine or ask an employee to self-isolate?
With a known exposure without using the appropriate personal protective equipment.
Have you had to do that yet?
Yes.
Do you think any other measures need to be taken in the city or in the county to prevent the spread, or do you think what we have right now is working?
I don't believe that it's working as well as it could. If you look at, there's a lot of information out there, and look at the countries that have been most successful in curtailing and flattening that curve. It's about getting really disciplined, about being careful about self-isolation and basically sheltering in place. Unless people do that effectively, we're going to have more infections, and with more infections, we're going to have 15% of those are going to get sick, and some percentage of them are going to die. And the better we do at getting people to really follow that. Now, we don't have a militaristic government, thank God. I'm happy to be living in a democracy that we live in, but with that comes the responsibility of being a good citizen. And if everybody doesn't behave that way, and I'm not blaming people in the context that, you know, I think they're purposely trying to infect others, but the reality is what you don't know, you don't act on, and people don't really understand this. I mean, we haven't had a thing like this since 1918, you know. And it's something that we just aren't familiar with. You haven't had an experience like this, and you know, people just don't understand how dangerous this is. A simple thing like a handshake can spread disease, and we have to just get that as a population. You know, I think most health care providers know it now. I mean, there's a lot of information out there. If you want to just be really woken up, go onto YouTube and just hear about, you know, young doctors and nurses that are ventilated now because they're working in the hospitals in New York City and you know, in other places around the country. And it's scary, you know, and we want to protect ourselves, but, you know, we also want to take care of people. I mean, it's what we do for a living, and we're going to be there to do that, but it gets a little daunting when you think about what this could evolve like. So I think, you know, at the end of the day, we're not doing enough, and the more we do, the better, you know, we'll flatten that curve.
What do you say to people who believe this is still something that's far away from them? That still, you know, those crises are in New York, they're in Washington, they're in other countries. What do you say to those people who are...
I would say educate yourself, you know, learn, you know, just, you know, education is power, and that power will give you some autonomy and some control over this, and you need to take that control. And, you know, we can own this. You know, we can do a good job with this. We can beat this in the context that we can subdue the amount of infection in our community, but it takes all of us working together to accomplish that. It's not going to do it by itself, and it's not going to do it by pretending it's not real. Got to take it seriously.
Good.
Okay. All right. Thank you all.
Good afternoon. Whitney Craig from the Midland Health Department. We currently have the one resident, male resident of Midland in his 60s. He has been tested as positive for COVID-19. The results came in today. The resident was tested at a private provider. So in addition to the positive that the hospital got today, we got our one positive. The health department is still investigating the case, so it's unknown as the source of the infection. He is doing well. He's at home. With the case that's positive from the hospital, and then the case that's positive from the health department, because we did get these results today, the investigation is still ongoing. So, as I said before, for this specific individual, the source is unknown. Once we do get that information, we'll be able to share it if it is travel-related, community spread. Yes.
Earlier, Dr. Wilson was just talking about the patient that just passed away.
Mm-hmm.
A lot of the reasons why he died had to do with this age. This patient is around roughly that same age. Do you all have the same fear of the same type of sequence of events happening to this patient too?
Currently, he's at home, so we're hoping that he'll have better outcomes than the other gentleman that passed today.
Okay. Is there any difference between this patient at home and the one that was in the hospital as far as their condition and y'all's hopes that he can get better?
Well, neither of them had any underlying conditions, so as of right now, it's still kind of a blank slate as to what we know about this guy, because we did just find out today we haven't been able to do any additional investigation to find out if he does have any underlying conditions, but the status that we have for him right now is that he is doing well. He is at home.
It's my understanding that people with COVID-19 can crash really quickly. So is there anyone checking up on this elderly gentleman?
Yes. Yes, the health department, we keep in contact with the individuals that we find out are positive, and that is to make sure that we can get correct and accurate information, timely information, and we make sure that they are in contact with who they need to be in contact with, just in case if the symptoms do get to a worsened state.
Now, I know you said that the case with the gentleman is under investigation. Can you say if this has any ties to the states of Mississippi or Missouri?
As of right now, the patient said that he did not have any travel. So for right now, I can say no to that. But until we can talk to him more, that may change. But as of right now, it is still unknown. So we'll say no to travel. But sorry, it's still unknown. Yes.
Yeah, on that note, I saw that Lubbock, they've been releasing some more specific information about some of their patients and where they've traveled recently, both locally.
Yes, that's a good question. So part of the investigation that goes into these cases is finding out that information. So as we get more information, we can share it. But again, because these cases just came out today, what we know is just very preliminary. And so we don't have any information in regards to their movement in the community.
Absolutely. But when you guys kind of go further along in your investigation, would you guys plan on releasing a list similar to that so people can kind of see a little bit more detail about where these people have been?
Oh yeah, sure. We can share information so that people feel more informed.
Okay.
Yes. Oh, I'm sorry. Hello.
Well, on his question, do we have more information about the person who passed away and where that person's been? I think it was said he had maybe been to Colorado, but also possibly multiple states. Do you have more information about where the person who passed away had traveled?
At this time, we don't have any additional information. His case is still also ongoing. The investigation is still ongoing with him.
And is the person who is at home there based on doctor's orders or based on is a physician said, yeah, you're okay to be at home for right now?
Yes, as Dr. Wilson alluded to, if they're in the hospital versus staying home definitely depend on how sick they are, and he was not sick enough to be admitted into the hospital.
Can you give us any more information about the adolescent and where they had traveled to?
still, that would be ongoing investigation. We just got the results today, so we haven't been able to make that contact to find out any type of contacts, travel history, but that is part of our investigation.
So does the adolescent know that they are infected?
Yes, we make those notifications before we release that information, just so the family can be aware.
Is there any information that could possibly tie the adolescent to the group of students that were in Spain from the Christian?
There is no information alluding to that. No. Yes.
And for me, but I kind of got a little bit caught up on like all the different numbers of patients. Can you go through just the numbers of how many patients we have total in the county, and which ones are at home, in the hospital, critical care, and just kind of that breakdown?
I do not have those numbers for you, sir.
Okay.
I'm sorry. No, we don't have the breakdown of the numbers at home and in the hospital. The hospital would probably have those numbers a little bit better than we would, because the numbers that are coming from us are either numbers that the hospital has given us, or like today, that tested positive. So we won't know if they're at home or if they're in the hospital till we get those results, and we only have the 3 back: the one that passed, the one from the hospital, and then the one that tested with a private provider.
Does the health department receive tests from private physicians at a slower pace than the hospital, or are they equal usually?
That is a good question also. So the results that we are receiving from the private providers are coming in on a positive result basis. So if they do receive a negative, we have not been getting that information. We would like to get that information, but we are not getting that information. Whereas the hospital lets us know regardless of the status. They let us know immediately when they're testing individuals. So I don't know if that answered your question or not, but yeah, it's a little different.
Kind of like a black box almost.
Yeah. All right, no problem.
For the county, not a lot has changed today. We have scaled back our people that are at the courthouse, but our services are still intact. You just need to go about accessing those services a little differently. So if you'll call whichever department you're needing, they will tell you what the new procedure is, and we'll get you taken care of best we can. One of the positives I took away today, listening to the president, was he's shooting for an Easter day to start coming out of this thing. That doesn't mean this thing's over come Easter, but for me it gave me a positive in that it gave us a day to shoot for. And I think if we as a society knew there was an end game to this, we would hunker down right now and take care of what needs to be taken care of. The word quarantine is a hard word, but I think it's a word we need to use on ourselves. We self-quarantine. We're calling it self-isolate. That's a good way of putting it. That's a soft way of putting it, but I think we need to self-quarantine. That's what works. You've heard from the professionals, and we need to quarantine ourselves more than anything. We're a free society, and with that being free, it comes with responsibilities, and the responsibilities is to act responsible, to make good decisions for ourselves. If you don't make good decisions, we've got a jail full of people who didn't make good decisions for themselves. If we don't make good decisions here, we're going to end up with the healthcare providers taking care of us. So I would just reiterate, please maintain your distance with folks, stay home unless you just have to be out, and be sure and practice keeping your hands clean. So other than that.
Judge,
Yes.
what about, have you done anything to cancel or slow down any transfer of prisoners to other counties?
Yes, we have stopped transferring. We don't take any prisoners in. We're not sending any prisoners out. We have brought the population down. Yesterday, I believe we gave numbers of roughly 75, and I don't think it was many more today, about another 10 I think were identified, I think. We're trying to bring those down. Again, if it's a misdemeanor and we can deal with it with a citation on the street, we're going to deal with you at some future date, so we're not bringing any more people in than we need to. But hope that answered. Yes, sir.
Judge, Do you think the Lieutenant Governor did a disservice to the seriousness with which you, the mayor, other people in Midland County have been telling people in the county about coronavirus? Do you think his comments, I guess it was last night, kind of did 2 steps back for what some of our leaders locally are trying to say?
When I heard it, I hoped he misspoke. When you're talking a lot like this, you're trying to say as much as you can and be as articulate as you can. Some of us aren't as articulate as others, and I'm just really hoping he misspoke. I'm hoping he's looking back and going, I might not have should have said that. So I'm going to allow that unless he reiterates it. He thought he was probably making a good point, but no, I didn't. I took offense to it. I mean, we're trying to do something here, and like you say, he took us back a step. Okay.
Well, again, thank all of you for being here, for your time. I hope this is helpful to everybody who's watching. And you've heard enough to already be able to communicate to those who are watching, those who are listening, that what we are dealing with, we've been saying this over and over and over again, is serious. It's not something to be joked about. Like someone joked at me yesterday about it when I passed him in a particular place, that what we're facing as a city is dire. It's serious, and our doctors and our professionals are telling us that we're seeing how serious it is. I'll take you directly to what City Council did today. Some of you had talked to you about this issue when we were out in the hallway just so we could have this discussion. But today the City Council passed another declaration that included what the governor has asked us to do, what the president has asked us to do, and what the CDC has asked us to do. What we stopped short of was mandating a shelter in place. And so just to be very clear, and I'll be on Facebook Live tonight at 8 o'clock to talk more about this, but when we look around the community and look around the state right now, and we see Dallas, and we see Austin, and we see Waco, and we see San Antonio issuing these shelter in place declarations, I've taken the time to actually read the entire declaration, every single one of them. And at the very front of them, they tell you we're going to shelter in place. But then when you get to about page 3, 4, 5, 6, 7, or 8, there are all the exceptions of what it means to shelter in place, all the things that are defined as essential businesses and all the things that are non-essential businesses. And I can tell you right now, from what I'm watching in Midland, Texas, our people are already doing what's being asked of people to shelter in place in particular regions. Now, the reason this conversation is so important is because I believe communities are being asked to shelter in place, and our council believes people are being asked to shelter in place because people are not doing what the communities are being asked to do. And I think what we're doing here in Midland, I think what we're doing in Odessa, as the mayor of Odessa and myself both travel our cities and drive the streets almost every morning and every afternoon, we are seeing our grocery stores, we are seeing our retailers, we are seeing our restaurants doing the things that we need to do. As I've said in every single press conference, if you don't want to be told what to do, then do what is being asked of you at this particular time. If you have not thought this is serious, then it's time for you to understand that this is incredibly to put in a shelter in place. We have a shelter in place that's actually with fewer exceptions than what are being promoted out there in other cities. We're asking you to get serious about it with us, to make sure you're doing the things you need to do with social distancing, to do what Dr. Wilson told you to do, and actually you're doing it. And so continue to do those things, become more aggressive about those things, and if you want to continue to be people that treasure life, liberty, and the pursuit of happiness, then with that responsibility, which our freedom comes with responsibility, be responsible in this particular situation to everyone around you. As I texted a friend of mine who's in his 80s today, let me know what you need. We need to be doing that all the time. If we think we need something, do you really need to get out? Be sure and get outside and walk around and spend some time outside. But even today, just to communicate the message even more directly, we're shutting down the city golf course because of people having some ideas about how we needed to take care of that as well. We want you to go to parks, but don't gather around in groups when you're at the parks. Just practice this social distancing. So my message to you is, we as a city council, and we deliberated long and hard this morning, we looked at all of these shelter-in-place documents, and they're unenforceable most of the time. And the exceptions are extremely broad for everything that you want to do. And as I asked you as a press corps to go ahead and read those before you go on the news or before you say anything about it, you read them all the way to see what's out there. So that's where we are as a city. I want to reiterate the message that our hospital staff is working extremely hard. They're working incredible amounts of time. They're stressed. And I also hope you understand, and you heard what Dr. Wilson said when he talked about infectious disease doctor and not in the plural. We're not a region that has all kinds of specialists around that can handle if we get overrun because we don't take care of what we're supposed to take care of as citizens. Just to be clear, we're asking you to shelter in place. We're not telling you to shelter in place. It's your choice whether or not you shelter in place and do the right things for this city and for this region and for our health. Any questions? Yes?
Just for clarification, did you say you did or did not shut down the golf course?
We did shut it down this afternoon, much to the chagrin of every golfer who socially distances anyways, because that's why they're playing golf. They don't want to be around anybody. Yes?
Knowing one of the citizens passed away due to this disease, what do you have to say in regards to that?
If the question is what do I have to say in regards to someone who has passed away, I'm heartbroken over it. I'm heartbroken over the fact that whether it was this or it was someone last week associated with something else, or we hear of a car wreck on I-20, it's a loss of life. And I hope that everybody in our community understands that what we're entering into now, in many respects, we can control, just like we control things, a little extreme to say this, but when we're driving, and we self-protect when we're driving so we can protect others, it's critical that everybody in the city realize that we're driving life right now. And the way we do life right now determines oftentimes the health of others, not my health. And so it's very important that we understand what has happened here today. And a life has been lost, and a loved one has been lost, and it's not because of something we've not heard of. And if another life is lost, it's not going to be because of something we didn't hear about. And if more and more people get sick in ways that are associated with us transmitting within this city, then we're not taking seriously the crisis that's upon us, and we better start taking it seriously.
Kind of like the last few weeks, churches have obviously paid attention to not congregating and not having services. And have you reached out or have you had any discussions with places like grocery stores, Best Buy, Home Depot, those kind of places where
Yes.
obviously happen?
Yeah, so I'm very proud of, number one, our Chamber of Commerce, who is beginning to reach out to these retailers to begin to push this message about how important it is for them to control what's going on with their crowds and the lines of people outside. I am extremely proud of our medical community, as Dr. Wilson talked about, who are helping us get this message out so that even our physicians are talking to these stores and helping them to realize we've got an issue. We need you to take care of this. Because even, go back to the shelter-in-place documents I talked about, which say that everybody can go to the grocery store, you can go to the big box store, you can go to the pet store, you can go to the liquor store, you can go anywhere you want to do. Most of them still don't even have anything in those documents other than maintain 6 feet of social distancing. I'm watching our community even trying to do better than that. I'm watching even retailers begin to take things out to the parking lot. We as citizens need to demand that of our retailers. We as citizens should not be told what to do, but we should be telling our retailers what to do for our safety. And so if you come to a retailer and they're not making you do these things, you should do them on your own. And you should make sure someone's in front of you. So we're beginning, I think our community is even beginning to understand we're going to take this upon ourselves to take this more seriously and to reiterate what Dr. Wilson said. And what I'm beginning to say over and over again, which is if you don't want to be told what to do what we're telling you to do so we can save lives you may never meet. That's the kind of situation we're facing.
When you and Mayor Turner had the joint press conference last week, y'all both alluded to in your individual declarations that anyone that violated the gathering ban was subject to a fine. Are you aware of any instances since then where you've had to fine someone for that violation?
We are not aware of anybody who's been fined, and therein is an enforcement issue, period. When you look at declarations all over the state that can fine somebody $1, the range I saw today was from $1 to $1,000. And so I'm not sure which one it is. We don't have the police patrolling these things. Our police departments at both cities are stretched already, and that's why it's going to be up to our citizens to just realize, self-monitor, and self-protect in this regard. And in fact, if you're seeing a business violating these things, you probably ought to just contact us about it. And but be careful with that, because we also live in a city that's very stressed right now. They're stressed economically, they're stressed physically. So the last thing we need to do is be getting mad at each other. And don't be calling each other out in negative ways in public and say, you're violating my separation space. Let's just be kind to each other. But the bigger part of your question is, no, nobody's been fined that I'm aware of.
What do you make of the mixed messages coming from Austin, our state leaders down there? The governor seems to be very direct. There is a certain level of seriousness, and the lieutenant governor, obviously, whether he misspoke or not, said something that didn't maybe help with the seriousness with which you were trying to portray. What do you make of all that?
Well, I think the governor is doing everything he can to honor what we believe as Texans and as Americans about life, liberty, and the pursuit of happiness and our freedoms, and hoping people will be responsible for this. I can't speak for the lieutenant governor. I neither watch Fox News or CNN. I depend on our local media here, quite frankly. So I don't know what he said. I've listened to him over the years, and I can only imagine. And so I think our governor is doing the best he can with the information that he has. He probably has more experts around him than any of us here at the city and local level. That's why we're trying to follow his lead and stay up with what they're doing at the state level, and we'll continue to do so. Yes?
Setting enforcement issues aside, do you think shelter-in-place orders send a more powerful message than your calls that residents take this situation seriously?
No, because I don't think shelter-in-place messages that have a whole appendix filled with things that you can do and you don't have to pay attention to, that tell you can still get in an Uber and a Lyft, you can still get in a taxi. I think the reason shelter-in-places are being promoted in these larger cities and of a greater density is because the people are not doing what they're being asked to do in the first place. And so they're having to go this extra mile, this extra step to say, because you aren't doing this, we're going to do this. And there's still not going to be an enforcement mechanism, because I don't imagine the Dallas Police Department is going to be driving around Dallas to see where people are violating these issues, because there's literally very few places where you're not in violation, because there's exceptions to all of it.
Well, I guess I wonder, do you worry that even though you're seeing positive results from your messaging to residents, that some residents may interpret the city of Midland's hesitation to implement shelter in place that they may not take this as seriously?
Well, I can't do anything about what people perceive in that regard. Whether people don't think we're taking it seriously or not is a judgment they're going to have to make on their own. I think we're taking it extremely seriously, and for multiple times now for our third press conference, we're trying to tell people, don't let us have to tell you what to do. Keep doing what you're being asked to do. All right, thank you all very much.